Hi, this is Dr. Rick Smith. Today I'm going to talk about how to read a sleep study. So if you know what that means you have been diagnosed with sleep apnea and a medical sleep doctor has given you a sleep study. So today I want to talk to you about, when patients come in, how do I review that sleep study and what do I look for when I'm looking at that? The first thing I look at is how well did you sleep in this sleep study, and it's called the sleep efficiency. You'll see that, sleep efficiency, and they'll give you a percentage. So if it's 90 some odd percent, that means that sleep efficiency was very good and the information that they got from that sleep study was very accurate. The next thing I'm going to look at is called saturation. How much oxygen was in your blood at the time of the sleep study? They'll have a minimum, how low it actually went to, and they'll have a mean. So minimum, anytime it drops below 90%, alarms go off if you're in a hospital setting. And so we're always concerned about a saturation below 90%. And we're also looking at the mean. So if the mean's above 90% and we're breathing 98 to 100% oxygen all the time in our blood, that would be what we're looking for. The next thing I'm going to look at in our sleep study will be what we call the AHI, which is the apnea-hypopnea index. And the apnea-hypopnea index, by definition, is when you hold your breath for 10 seconds or more. So AHI, anything below 15 we consider mild, 15 to 30 is considered moderate, and anything above 30 is considered severe. So depending on what your diagnosis is, they may base that on the AHI. The other thing that they'll ask for is RDI, which is called the Respiratory Disturbance Index. Respiratory Disturbance Index has to do with how many arousals you get. So if you hold your breath for 10 seconds or more while you're sleeping, your body's going to stimulate you and give you a shot of adrenaline that'll cause what we call an arousal. So arousals are important to cause, heart problems and what have you. So RDI, it's the same thing. Anything under 15 mild, 15 to 30 moderate, and 30 and above severe. All right. So that is how basically I'm looking at a sleep study. I will also look at things that have to do with sleep latency. Most people will fall asleep if they turn the lights on in about 20 minutes in a sleep study. And anything less than 20 minutes we call, it gets under classification of excess daytime sleep. Other than that, I want to know how long, if you have an apnea index and it's going to show me, by definition, 10 seconds or more, many people are going to be doing that more than that 10 seconds, so we want to see the duration of how long that apnea was. Anyway, those are some of the things I look at in numbers when I'm looking at sleep studies. If you have any questions, please give the office a call or give your sleep doctor a call to ask them to review that sleep study. Okay, again, thank you very much. It's Rick Smith.